Now let's review the major coagulation and platelet function tests. The prothrombin time screens for the extrinsic and common pathways. It measures factors 1, 2, 5, 7, and 10. It is widely used to monitor patients on oral anticoagulant therapy, such as warfarin, coumarin, or dicumarol. The reagent for PT testing contains tissue thromboplastin and calcium chloride. PT is particularly sensitive to the vitamin K-dependent factors. The results are standardized using the International Normalized Ratio, or INR. The reference range is less than 13 seconds. The therapeutic goal for anticoagulated patients is typically an INR between 2.0 and 3.5. The activated partial thromboplastin time screens for the intrinsic and common pathways. It measures all coagulation factors except factors 7 and 13. It is used primarily to monitor heparin therapy. The reagents include an activator such as kaolin, celite, or ellagic acid, along with platelet phospholipid and calcium chloride. The reference range is between 20 and 40 seconds. The therapeutic goal is 1.5 to 2.5 times the normal value, or alternatively, results may be interpreted using a heparin response curve. The Fibrinogen assay is a quantitative measure of factor 1, fibrinogen. The normal reference range is 200 to 400 milligrams per deciliter. The thrombin time does not measure defects in the intrinsic or extrinsic pathways. Instead, it assesses the conversion of fibrinogen to fibrin. It is affected by elevated fibrinogen levels, by the presence of heparin, and by other antithrombin substances. The reference range is less than 20 seconds. Bleeding time was historically used to measure platelet function and platelet count, but it has largely been replaced by more reliable testing methods, particularly the PFA. The PFA test measures platelet function in response to collagen, ADP, and epinephrine. It is sensitive to aspirin use, to von Willebrand disease, and to ADP receptor abnormalities. It has largely replaced bleeding time as a platelet function screen. Clot retraction evaluates multiple components: platelet function, fibrinogen levels, red cell volume, and fibrinolytic activity. It becomes abnormal when the platelet count falls below 100,000 per cubic millimeter. Both anemia and low fibrinogen levels reduce clot retraction. Rapid dissolution of the clot indicates increased fibrinolytic activity, as seen in disseminated intravascular coagulation. In Glanzmann thrombasthenia, clot retraction does not occur at all. In summary, PT and aPTT screen extrinsic, intrinsic, and common pathways. Specialized tests, such as fibrinogen assay and thrombin time, further evaluate clotting. Platelet function is assessed with PFA and clot retraction, with bleeding time now largely obsolete.